The most common football injuries are ligament injuries or cartilage injuries or soft tissue injuries to the rest of the knee and muscle sprains and stress injuries. The ACL is one of the commonest ligaments to be injured in football injuries. The menisci, both medial and lateral menisci, can also be injured either concomitantly or separately. These are the semilunar cartilages that line up the knee and cover the tibial surface or the leg bone. And then you have other ligaments such as the collateral ligaments. The medial collateral ligament is one of the commonest. Usually it is a minor injury, grade 1 or worst case scenario, grade 2 to 3. The grade 1s and 2s are usually managed conservatively, and the grade 3 usually requires surgery. Other injuries are stress injuries, hamstring injuries as well, which are related to overuse or lack of training or not being prepared enough for playing football. There have been quite a lot of developments in football sports injuries management, and one of the key factors that has been shown to have evidence-based backing in preventing football injuries is actual training to avoid ligament injuries such as ACL injuries. There have been quite a few studies done in the US and elsewhere to show that ACL rehabilitation, pre-season training and pre-season conditioning before the season starts is very, very important at reducing knee injuries, both ligamentous and soft tissue injuries. So it is all about conditioning both pre-season, throughout the season, in addition to excellent warming up prior to playing, as well as cooling down after playing. If you sustain an injury to your knee that causes pain, swelling, locking, knee giving way, or in other words, mechanical symptoms that does not resolve, then ideally you should be consulting your orthopedic surgeon for an assessment. You may need further tests such as an MRI scan, in addition to the clinical assessment, which is very important to be done within a short time frame after the injury. The specialists who can treat football injuries are specialist knee physiotherapists, sports doctors, as well as obviously orthopedic knee specialists who specialize in knee surgery. You have to have the expertise to be able to take a full history of the actual injury, the current symptoms, and do a formal full examination of the knee to assess for cartilage damage, ligament damage, soft tissue damage. It is very important to have the skills and expertise to perform a clinical examination, including the special tests in assessments of knee injuries. It is very important to look at the mechanics and why the injury happened and how you can prevent it. There are certain injuries that can be preventable, such as re-injuring your ACL. For example, if you've had an ACL injury, I would recommend that you would wear a knee brace to support the knee if you go skiing after the injury, whether you've had reconstruction or not. It is important to undergo preconditioning before a skiing season and before a football season to strengthen the muscles of the front and the back of the knee to prevent re-injury. It is important to ensure that there are no problems with the feet that may lead to running injuries, such as meniscal tears. A gait analysis can be sometimes useful, in addition to having the proper gear and footwear to perform the sport that you are performing to avoid re-injury.